You've always been someone who listened to reason. You showed up for your appointments. You took the medications. You followed the instructions because that was what responsible women do. You believed in prevention. You believed in early detection. And you believed that more care meant better protection. But now, something feels different. You're not the same woman you were 20 years ago. Not just older, but wiser. You're in a different season of life, a slower, more thoughtful one. And with this new season comes a new kind of decision-making. You've earned the right to pause before saying yes, to ask more questions, to say, is this truly for me? Because growing older doesn't mean handing over your choices. It means claiming your voice. Many women over 70 are still being offered tests, scans, and procedures that were designed for younger bodies, younger risks, and younger timelines. But in this season of life, what matters most is not doing everything. It's doing what matters, what protects your quality of life, what preserves your peace. And sometimes that means gently saying, no, thank you. So today, we're going to walk through 5 common health checkups that women in their 70s and beyond are often encouraged to continue, but may no longer need. Tests that sound helpful on the surface, but in many cases offer little benefit, and sometimes real harm. This is not about neglecting your health. It's about protecting your time, your energy, your joy. It's about choosing care that respects your stage of life. Let's begin with something most people have never been told to question. Overdiagnosis. Overdiagnosis sounds like a technical term, something far away from real life. But for older women, it's one of the most common and most invisible ways that unnecessary testing can take more than it gives. So what is it? Overdiagnosis happens when a test finds something abnormal. A spot, a cyst, a tiny mass, a lab result just slightly off. Something that looks suspicious but was never going to cause harm. And once it's discovered, the system kicks into motion. Follow-up scans, specialist visits, more tests, sometimes even surgery. All for something that would have stayed quiet, painless, and harmless if it had simply never been found. Let me introduce you to Loretta. She's 80, a retired nurse. Independent, witty, still volunteers every Friday at her church's food pantry. At a local health fair, someone offered her a discounted abdominal ultrasound. Why not? She thought. Just to be safe. The scan picked up a tiny lesion on her liver. No symptoms. No discomfort. Her doctor said, probably nothing, but we should check it out. Over the next 10 months, Loretta went through 3 CT scans, multiple blood tests, a consultation with a specialist, and a biopsy. The final result? The lesion was benign. But by then, Loretta had already canceled a vacation. She'd stopped baking, stopped sleeping, stopped feeling like herself. I wasn't sick, she told me. But for nearly a year, I felt like I was dying. This is the hidden cost of overdiagnosis. We find something. We fear it. We chase it. And often the emotional toll is far greater than the physical one ever would have been. Our bodies change with age. They collect harmless marks, liver spots, fibroids, nodules. But machines don't know the difference between aging and danger. They just detect. And once we detect, we feel obligated to react. Here's the truth no one says loudly enough. Sometimes doing nothing is the wisest thing you can do. This doesn't mean ignoring symptoms. If you're feeling real changes, pain, fatigue, weight loss, bleeding, you should absolutely speak up. Get checked. Follow through. But if you feel well, if your days are full, your sleep is sound, your meals taste good, you might not need the next scan. You might not need to chase a shadow that was never a threat. So the next time a doctor offers a test, just in case, pause. Ask, what will this test truly change? Will it improve how I feel or just give me something else to worry about? You've spent your life being proactive. Now is the time to be intentional. The goal is no longer to find everything that might be wrong. The goal is to stay grounded in what is already right. Your peace, your clarity, your beautiful, ordinary, symptom-free life. And if the choice comes down to chasing answers or keeping your calm, you have every right to say, I feel good. Let's leave well enough alone. For decades, the treadmill stress test has been seen as a smart, simple way to catch hidden heart problems. You walk. They watch your heart. If anything looks off, they investigate further. It sounds reassuring, proactive, responsible. But for many women over 70, especially those who feel well and show no symptoms, this test can lead to more harm than help. Let me introduce you to Mildred. She's 74, active, joyful, and walks 2 miles every morning. She bakes with her grandkids on weekends and still attends a Saturday dance class with friends. At her annual checkup, her doctor smiled and said, "Let's do a stress test, just to be safe." It felt harmless. She agreed. The results came back. Unclear. Not alarming, but not perfect either. "Let's look further," the doctor said. Soon, Mildred was referred to a cardiologist. Then came a heart catheterization, a procedure where a thin tube is inserted into her arteries to look for blockages. They found one small area of plaque. Not dangerous, not causing any symptoms, but just in case, they placed a stent. And that's when everything changed. The medication made her dizzy. She fainted at home, hit her head, and was hospitalized for 3 days. She later told me, "I felt perfectly fine before all of this. Now I feel nervous all the time, like something's wrong, even when it's not." This is the cascade effect. One test leads to another, and before you know it, you're being treated for something that never affected your life to begin with. It's not rare. It's not dramatic. It happens quietly, to thousands of women every year. And the worst part? Mildred's body was simply doing what aging bodies do. After 70, hearts change, arteries stiffen slightly, resting heart rates shift. But none of that necessarily signals disease. It just means we're living longer. Yet many machines, and even well-meaning doctors, treat any variation as a threat. Here's what many geriatric specialists now say. If you're not having chest pain, shortness of breath, or fatigue you can't explain, you likely don't need a stress test. So what should you do instead? Trust how you feel. Are you walking easily? Sleeping soundly? Carrying groceries without stopping for breath? That's your real data. And for prevention? Gentle movement, nourishing food, connection, calm. These are not just feel-good habits. They are real heart medicine with no dangerous side effects. You're not ignoring your heart by declining a test. You're honoring it by listening to it every day. So the next time someone says, "Let's test just in case," ask, "Is there a symptom?" And if the answer is no, you're allowed to say, "Thank you, but I choose peace over panic." Let's talk about one of the most common and widely praised tests, the colonoscopy. There's no doubt that for people in their 50s and 60s, this screening has saved lives. It finds polyps early, removes them before they become dangerous, and helps detect colon cancer when it's still treatable. But after age 70, and especially after 75, the equation starts to shift. For women who've already had 1 or 2 clean colonoscopies, the potential benefits shrink while the risks begin to grow. Let me tell you about Clara. She's 76, kind-eyed, sharp-witted, and bakes sourdough every Sunday morning. She had her first colonoscopy at 65, clear. Another at 70, still clear. At her next appointment, her doctor suggested 1 more. Just to be extra cautious, she agreed. She'd always been diligent about her health, but during the bowel prep, Clara became dehydrated. She fainted, fell, and broke her wrist. The colonoscopy itself was normal. Nothing was found. Later, she said to me, "I went in feeling fine. I came out with a cast, a hospital bill, and anxiety I didn't have before." Here's the truth. Colonoscopy is not a small task. It requires harsh laxatives, fasting, and sedation. All of these are tough on older bodies. Dehydration, low blood pressure, confusion, even post-anesthesia brain fog are common. For women who live alone, the risks multiply. A simple prep becomes a potential hazard. And here's what most don't realize. Colon cancer often grows slowly. Polyps can take 10-15 years to become serious. So for a healthy 76-year-old woman with clean screenings, the chance of finding something dangerous now is very low. Still, many go forward out of fear. Fear of missing something, fear of cancer, fear of regret. But fear isn't a reason to test. Understanding is. That's why many doctors now recommend stool-based screenings, like FIT or Cologuard, for older women. They're done at home, no fasting, no sedation, no risk of falling. Are they perfect? No. Are they enough for many older women? Absolutely. So, before you schedule just 1 more, ask, have my last colonoscopies been clear? Do I have symptoms? Pain, blood, unexplained weight loss? Am I doing this from informed choice or from fear? Because the goal isn't to keep testing until something is found. It's to protect your dignity, your energy, your ability to move freely and sleep soundly. You've already done the right thing for decades. Now you get to do the wise thing, The thing that honors the body and life you've built. Full body scans. They sound high-tech, responsible, smart. A single scan that looks at your entire body, head to toe, catching anything dangerous before it becomes serious. It's often marketed as the ultimate form of prevention. And let's be honest, it's appealing, especially as we get older and wonder, is something happening inside me that I don't know about? But for many women over 70, full body scans don't bring peace. They bring problems. Let me introduce you to Joan. She's 78, healthy, sharp, not on any daily medication. She keeps a small garden, volunteers at her local library, and still drives herself to lunch with friends. At a community health fair, a private company offered discounted full body scans. Joan said yes. Why not? It'll ease my mind. The scan found a tiny lesion on her kidney. No symptoms, no history, no pain. But the word lesion triggered alarm. Within a month, Joan had seen a urologist, gone through multiple follow-up scans, and scheduled surgery to remove it. The lesion turned out to be benign, completely harmless. But the recovery wasn't. The anesthesia left her groggy for days. Her appetite dropped. She had trouble sleeping. Her energy didn't return for months. She told me later, I went in feeling perfectly well. I came out feeling like a patient. This is the unseen cost of full body scans. Machines are powerful, but they're also blunt. They find everything, including small, harmless changes that come naturally with aging. And once something is found, even if it's meaningless, we feel obligated to act. That's human. But it's also where harm begins. And here's what's worse. These scans are rarely covered by insurance. Women often pay hundreds, sometimes thousands of dollars out of pocket, only to enter a tunnel of testing, anxiety, and unnecessary treatment. To be clear, if you have symptoms, pain, bleeding, unexplained fatigue, yes, get checked. Yes, follow through. But if you're feeling well, sleeping well, and living well, ask yourself, what am I really buying with this scan? Will it truly bring me peace, or just introduce new fears? Remember, not every shadow needs a spotlight. Not every irregularity needs a label, and not every discovery deserves your time, energy, or trust. You've earned the right to choose clarity over chaos. To ask your doctor, will this scan change how I live or only how I worry? Because real peace of mind doesn't come from machines. It comes from wisdom, from choosing what's actually helpful, not what's simply available. Now you've heard them. 5 medical checkups that are still being recommended to women over 70. But that might no longer serve the person you've become. You've walked with Loretta, who chased a harmless shadow for a year. You've listened to Mildred, who felt healthy until the testing made her sick. You've sat with Clara and Joan, whose peace was shaken not by illness, but by well-intentioned intervention. And Evelyn, who trusted the routine, until it left her hurting, healing, and unsure of her body. Maybe these stories echoed something in your own life. Maybe they gave language to a feeling you've carried quietly for a while. Do I really need to keep doing all this? That question is not rebellion. It's wisdom. Because growing older doesn't mean surrendering your care. It means becoming smarter about how you care. It means asking, is this test about me or just about habit? Is this scan going to help me feel better or just give me something to manage? Will this procedure protect my quality of life or put it on hold? For years you showed up. You followed through. You listened, learned, cooperated, trusted. Now you get to choose. From a place of power, from a place of clarity, from a place that knows what peace is worth. This stage of life is not about chasing every threat. It's about preserving the things that allow you to live. Your energy, your sleep, your freedom to move, to think, to laugh, to be. Health is no longer just about detection. It's about discernment. It's not about doing more. It's about doing what matters. So the next time you're in a doctor's office and a test is offered, try asking this. Will this change how I feel or just how I worry? Is this meant for someone my age or someone 20 years younger? What if I waited? What if I trusted my body instead of doubting it? And most of all, trust yourself. You've lived through seasons of storms and calm. You've raised families, built careers, buried losses, and carried grace. You've earned the right to say, no, thank you. Not out of fear, but out of understanding. Because you are not a scan. You are not a lab result. You are not a condition waiting to be caught. You are a full woman, with decades of wisdom, with stories in your skin, with a life that deserves respect, not more pressure. So let your care reflect that. Let your choices reflect that. Let your voice at the doctor's office reflect that. If this video gave you a new thought, a little courage, a bit of peace, tell us, which part resonated with you? Was there a test you've always said yes to? That you're now ready to rethink? Drop a comment. Or write it in your journal. Or say it out loud to yourself. And if this video helped you feel seen, we invite you to subscribe so we can keep walking this season of life together. Here at Wise Elders Insight, we believe that aging is not about losing relevance. It's about reclaiming what truly matters. You've spent your life showing up for others. Now it's time to show up for yourself, gently, powerfully, on your own terms. Thank you for being here. And more than anything, thank you for being you.